Hi, my name is Mike Riley. I'm the Director of Healthcare here at IPORT. At IPORT, we're truly helping healthcare customers transform with iOS, along with IPORT's enterprise-class wireless cases and chargers, and leading clinical and patient-facing iOS applications. We are helping healthcare organizations transform with iOS, better connect with their patients, better connect their caregivers one to another, and enable truly connected care. Now, one of the primary areas where we still see an issue across the care continuum is really around patient check-in. And this is an easy opportunity for health systems to truly engage with their patients to help them feel seen and valued and also drive clinical efficiency. When I was a kid many years ago, this process still remains largely unchanged. A patient comes in, whether it's an outpatient clinic or an urgent care clinic, walks into a care facility, they're typically handed a stack of papers. Within that stack of papers, they're asked to fill out patient history, medical history, family history. They're asked to sign consent forms. And then when they're done with that, after 10 to 15 minutes, they come up, their hand hurts, they hand over the stack of papers to the front desk associate who then inputs all that information in the EHR. The patient then goes and sits down. 95% of a patient's time spent at a clinic is spent waiting. So there's typically some animosity, some trepidation as they're waiting for themselves or their loved one to begin their appointment, and they're just there waiting. When they're done, they finally come back to meet with their care team. The care team then asks them all the same questions that they just got done filling out because that information wasn't inputted in the EHR and they did not have the opportunity to review it. Now, leading providers out there are transforming this interaction with iOS and IPORT. So I want to introduce you to a really cool application called Tonic Health. There's a variety of applications out there. Epic just launched Welcome for iOS. But it's a really simple solution using an iPad. IPORT, these are one of our pillar kiosks. The patient would come up to the kiosk, as you can see here with Tonic Health. They do a check-in process. It's a Disney-like experience. It's super simple to navigate through to input all your patient history, sign consent forms, using Scanit's powerful barcode scanning technology that transforms the camera on the iPad. You can scan your insurance card, you scan your ID card. All of that is automatically intaked into the EHR. Or the patient could come up, the front desk associate could hand them one of our iPads in our Connect cases, super streamlined. They can go sit down in the comfort of the waiting room, sit down in the chair. We've even got an easy stand right there where they can input all that information in there using Tonic's app, scan their insurance card, scan their ID card. All that information, again, is intake directly in the EHR. They can keep this iPad with them throughout their time in an outpatient clinic. You could have information on other services that the clinic offers. You could even have games and entertainment. As they go through and meet with a care team, that care team has the opportunity already because all of the information through Tonic and other apps has been intaked into the EHR to review the patient's information beforehand. So it leads to a better consultation. They're just confirming the information that was there. When the patient comes through in an outpatient setting, that iPad again through Tonic could even have a patient satisfaction survey sent to them right then. So this would enable them to provide real-time feedback to the clinic. This is one of many examples of how we're helping healthcare customers transform with iOS.